Good afternoon, everyone. During the summer of 2021, we saw record-breaking numbers for COVID-19. Record-breaking positive cases, hospitalizations, and unfortunately the death of our fellow community members. The Delta variant upended our community and once again threatened our hospitals, our livelihoods, and those we love. And we have put in the work since then. We've worked to vaccinate our community. We've worked to provide boosters for everyone eligible and continue to stay connected with our healthcare partners, many of whom you see here, to meet your needs as best as possible. That surge, that wave of COVID-19 has since settled. That tide has retreated. Today, we are in the midst of yet another wave of COVID-19 infections, and this tide has risen once again. The Louisiana Department of Health reported a 7.8% positivity rate for the 2 weeks leading up to the Christmas holiday. Now that means that 7.8% of COVID-19 tests had positive results. To put this in perspective, the positivity rate in our parish from December 9th through December 15th was 1.4%. It doesn't take a statistician to see the threat within this sharp incline. We're expecting this number to grow as a result of people gathering in close quarters to celebrate the holiday. These fluctuations are constant, but we know the steps we can take to protect each other. We've done this before, and we can do it again. We need to work together to accomplish this goal. Of course, you've heard it before, but I'm gonna say it again. Mitigate, wash your hands, practice social distancing, and wear a mask when you are around others. These tools are easy and simple for everyone. We have free life-saving vaccines available to all of us. These vaccines help to drastically reduce any symptoms of COVID-19. They prevent hospitalization. They save lives. As of Sunday, January 2nd, the Louisiana Department of Health reported that 86% of the COVID-19 hospitalizations were not fully vaccinated in East Baton Rouge Parish. We've seen how these vaccines are effective in preventing these severe outcomes. Currently, 59.1% of East Baton Rouge Parish total population has initiated the vaccine series. We've made great progress in our efforts to go get vaccinated, and I know we can work together to continue this effort to keep our parish healthy. If you have any concerns or if you have any questions about COVID-19 or the vaccine, please reach out to your trusted healthcare provider. In addition to vaccines, we need everyone to do their part and go get tested. Omicron is a highly contagious variant. Our medical community and experts are reporting that it spreads faster than other variants. Get tested if you go to large gatherings. Get tested if you feel sick. Get tested if you were exposed to COVID-19. Knowing your status is essential to stopping the spread amongst each other. Now, these simple steps have proven their efficacy time and time again. Throughout this pandemic, our healthcare professionals have done the heavy lift. They've worked long hours and risked exposure to care for our community. When we do our part, we protect not only ourselves, but our healthcare heroes who have made great sacrifices in the last 2 years. With that being said, I think it's important for our community to hear directly from our healthcare partners to understand the gravity of this situation and the steps we can all take to limit the spread of COVID-19. Up first, we'll have Dr. Mike Rolfson from the Baton Rouge Clinic. He will be followed by Dr. Louis Minsky of Baton Rouge General, Dr. Amy Rabelais of Ochsner, Dr. Katie Taylor of Our Lady of the Lake, and Sherry Johnson of Women's Hospital. Thank you all. Dr. Rolfson.
Thank you, Mayor Broome, and thank you for this opportunity. I just want to start off this conference today by telling everyone that we in the healthcare community totally understand, believe me, we understand your frustration with dealing with 2 years of COVID. I think everyone's tired of it and frustrated with the constant changing recommendations. You hear mask, don't mask. You hear how many vaccines you need, the testing ability. So first we have it, then we don't have it. And you need to understand that these guidelines, these recommendations change based on what we see in the community and the country as far as the vaccine, as far as the virus and how it evolves and what's happening in our community. So various times shortages will occur and we'll change the recommendations. The virus mutates and we change the recommendations. So we ask you to be patient and understand that these recommendations change based on the science as exists at the moment, and it may actually change again tomorrow. So be patient with us and stay tuned for constant changes. I also want to say that, as Mayor Broome said, the Omicron variant is definitely hitting our community. It is really making a big outpatient problem for us. So many patients are positive now that we're starting to run out of tests, which is a real problem. So everyone needs to be patient with us on that front as well. If you do test positive, all the guidelines that have been discussed need to be followed, including isolating. There are different layers of protection for our community, including vaccination, but also masking, hand washing, and social distancing, as Mayor Broome pointed out. So with that, I'm going to turn over to my colleagues at Baton Rouge General, Dr. Lewis Minsky.
Thank you, Dr. Austin. Good afternoon, Mayor President Broome. Thanks for having us here again. What a less than ideal timing for the holidays, right? Here again, there's no denying that the next surge is here with us. We're feeling it in our communities, we're feeling it in the ambulatory practices, we're feeling it in our families and our fun time. We've heard many people say that they know more people now that have COVID than they have in the last 2 years. And that's true, and speaks to the highly transmissible state which the Omicron variant has provided for us. We have quadrupled our COVID inpatients since the week before Christmas. Still about half the volume that we had during the peak surge of Delta, but rapidly increasing. And we anticipate in the next week following the holidays that we'll continue to see that uptick. Fortunately, they're not as sick as they were before. While our COVID units are full, we only have about 15% in the intensive care unit compared to almost 50% during the surge of Delta. So the patients aren't as sick, and they're also not as young as they were. During the last surge at the peak, about 45% were under the age of 50. This time, it's only about 22%. So far, we've seen a number of people in the ambulatory practices that test positive, or they've been exposed, or they have symptoms. So we anticipate the numbers are actually higher because we don't have a good way of tracking the home positive test. We have noticed that in the patients who are being hospitalized, there are a few that are vaccinated. 75% did not receive the booster shot. So we're learning very soon, very rapidly rather, with the data coming in that the booster does help with the Omicron variant. In fact, this morning, Pfizer has moved their timeline for the booster from 6 months back to 5. And earlier this week, we know that the 12 to 15-year-old age group has now been approved for the booster vaccine. Our bodies are learning to fight this infection over time. It's not simple as go get a vaccine, measure your antibody levels, you're not going to have any problems. You need to keep up with the vaccines, we need to keep up with the boosters. As there's a need to change the booster makeup, that will be done. I know Moderna is already working on one to make sure that we're staying up with the variants. Just like the flu that's been here for so many years, our body has learned T cells and B cells and all the fancy words that we hear on Facebook and social media that we want to know how well our immunity is. Our bodies are learning, and we just need to give that opportunity, and vaccine helps us to get that extra step to protecting ourselves and our loved one. Masking is important, social distancing. So get a booster. If you haven't started your initial series, it's never too late. Speaking of symptoms, we're seeing a little bit different symptoms than we saw with Delta. There's a lot of patients complaining of night sweats. We didn't really see that before. We have not seen a number of people with altered sense of taste and smell as we did with earlier variants. There's been some, but not a lot. A lot of cold and flu-like symptoms, post-nasal drip, itchy cough, maybe fever, achy, headaches, a lot of fatigue, 3 to 5 days. Usually they're getting through this. The mayor said know your status, and there's a lot of conflicting information. Get tested when you have symptoms. Get tested before you go back to work. But we don't have any tests. How do you manage that? We've done it with the flu. We've done it with the cold. I'll encourage you, if you have symptoms, you're not able to get tested, you're not able to see your doctor, stay home for 5 days. Isolate yourself. When you go back to public, wear your mask. Treat your cold symptoms like you would any other cold. There's no infusion therapy right now. The oral therapy that's available, we had 50 doses delivered to the state of Louisiana. It's going to be hard to come by for a short while. Fortunately, this is positive. Patients seem to be getting well without it. If you're at high risk, stay in touch with your doctor. Know that if you're getting worse, go to the emergency room. We're prepared to handle you in the emergency room if you're sicker. Fortunately, the ones that are in the hospital right now, they're getting supportive care mostly, oxygen and some steroids. Steroids not the answer early on, but it can be helpful when the symptoms persist. So again, I encourage you, know the symptoms, wear your mask, keep your social distance, avoid large crowds, particularly where there's not a lot of masks being worn. Protect yourself, protect your family, and know the symptoms. Thank you. Thank you again, Mayor President Broome.
Hi, thank you again for hosting this very important meeting. I'm Dr. Amy Rabelais with Ochsner in Baton Rouge. And what we are all here to talk about today is how our community can support each other and can also support the healthcare community, because we are certainly all in this together. It has been a very long 2 years, and everyone is tired. You know, we're tired of wearing masks, we're tired of not having our normal lives, and our normal lives will come back. We're just not quite there yet. So what do we need to do as a community and as a society to get through these next few very important weeks? Right now, the most important thing that we can all do is continue to use common sense. So masking, social distancing, avoiding crowds, all of those things that we know that have been effective throughout this entire pandemic are still important. Right now, there is a significant lack of testing materials and testing supplies. If you are not currently symptomatic, please do not go to the urgent care or emergency room for testing. We do have supplies at urgent care and emergency rooms for symptomatic patients, and we want to really save them for those patients who are ill. If you need testing for asymptomatic reasons, I would encourage you to find a community testing site. If you have symptoms, and if you have been exposed to COVID, and you have symptoms such as a sore throat, fever, runny nose, and you are unable to get a test, that's okay. Please treat yourself as if you were positive and stay quarantined and isolated for 5 days according to the recent CDC guidelines. According to those guidelines, you can come out of quarantine on day 5, assuming that your symptoms are getting better, other than cough. Certainly a cough may linger for a little bit longer. We do hope that rapid tests will have greater availability in the coming weeks, and they should. And again, as Dr. Rolfson said, that may change the guidelines. It may change the testing pattern that we are currently recommending. The most important thing is that if you are having symptoms, please stay isolated, stay home. I can also not stress enough the importance of being fully vaccinated. Currently, the definition of fully vaccinated is 5 to 6 months after the 2-shot Pfizer series. So if you are not yet fully vaccinated with a 3rd booster, please do so immediately. Thank you.
Hi, my name is Dr. Katie Taylor. I'm the Medical Director of Infection Prevention at Our Lady of the Lake. Today I wanted to go over some of the numbers we're seeing at the lake, particularly, and compare them to Delta to give the community some advice. So first off, we are seeing less ICU admissions as in the Baton Rouge General. Today we have 18% of our admissions were in the ICU compared to 40% in the surge of Delta. I think, though, putting these numbers out and saying that Omicron variant is a mild variant is doing a disservice to our healthcare workers and to the patients. Any disease that can land you in the ICU is by definition not mild. The other concern we have is we are seeing record daily highs of new cases. As these cases build up, the number of total ICU admissions may end up being similar to or even greater than we saw with Delta, but we won't know until we reach the peak of this surge in the next few weeks. Another data point to compare to Delta that was similar is that the majority of severe diseases are in the unvaccinated population. Currently, 75% of the patients in the hospital are completely unvaccinated, meaning they never got the first 2-dose vaccine series. And 90% of our patients are not up to date with vaccinations, which means that if they're due for a booster, they have not yet gotten one. The two major strains we are seeing in our hospital system today are the strain on testing and testing shortages and staff shortages. Anytime the transmission within your community is great, this is going to affect our staff, and it's affecting patient care, not only for COVID patients, but for other people that need to come to the hospital. So we encourage the community to continue to do mitigation strategies. Number one and foremost, please get vaccinated. Get vaccinated, get vaccinated, and please get boosted if you have not done so. Again, also, as all of the physicians here have said, please mask, avoid large social gatherings, and stay home if you're sick. We need everybody to help us remove the strain from the healthcare system and keep both our patients and our healthcare workers safe. Thank you.
Hello, I'm Cherie Johnson with Women's Hospital. I'm the Chief Nursing Officer and Senior Vice President over Patient Care. I know that we've talked a lot about COVID and we're really tired of it and quite over it. But this Omicron variant is significantly impacting the women and infants in our community. At Women's Hospital, we are seeing record levels of sick patients with the Omicron variant in our hospital. That will negatively impact your birthing experience. You will have less visitors. We're going to have to watch your baby longer. So please protect yourself, wash your hands, take care of our women and infants in our community. Wear your mask. Take care of our women who are going through cancer treatment, whether that's breast cancer or GYN cancer. Their immune systems are weakened. They take care of our families and our communities. Please continue to help us and take care of our community by masking, by washing your hands, by avoiding large gatherings. And most of all, there's a lot of misinformation out there about vaccines. They are safe for pregnant women. Please get your vaccine. It is crucial in preventing the contracting COVID as well as spreading COVID. We thank you for your time. We thank you for your support for all of our healthcare workers who are really being affected by this virus. And we want you guys in the community to support our healthcare professionals and help us prevent the spread of this virus. Thank you.
Thank you. I want to thank all of our healthcare professionals for sharing these vital messages with our community. And I want to thank all of you all for joining me today as well. Just as I said before, the fight against COVID-19 is a team effort, and we're so fortunate that we've had all of these medical professionals, everyone who represents the fabric of our medical community, in alignment with us. The truth is, government can't solve it alone, and our healthcare partners can't do it alone. Our residents can't do it alone. And so we all have to do our part. In the state of high transmission rates, our business leaders, community organizations, and residents must take any necessary steps to prioritize health and to slow the spread within our community. For example, I, along with my city parish team and partners, we have elected to put the health and safety of the community first. And so you've heard me talk about our exciting Martin Luther King scheduled holiday where we were going to spread this out of series of events for a week. Well, we've decided to reschedule our events for Martin Luther King celebration holiday, and we're going to do that in our service projects in February, okay? And so we're still going to honor the legacy and the impact of Dr. Martin Luther King on MLK Day, but we're going to do it through a virtual platform. More announcements will come this week, and you can stay updated by visiting mlkholidayBR.com. Before I close today, I want to share some information about vaccines, testing, and services available now within our community. You can get a free COVID-19 vaccine from your healthcare provider, a pharmacy in our community, or community vaccine site. There are 3 community vaccine sites. You can go to Moody Coliseum at Southern University. You can go to the 4-H Mini Barn at the Student Union at LSU. And you can also go to the Mall of Louisiana right next to the Apple Store. The operating hours for all vaccine and booster sites can be found at brla.gov/COVID. That's brla.gov/COVID. Now, there are multiple COVID-19 testing sites that have no out-of-pocket costs for our residents. Free, no out-of-pocket costs community COVID-19 testing sites are located at the LSU 4-H Mini Barn, Southern University Moody Intramural Sports Complex, LSU Student Union, East Baton Rouge Parish Health Unit, and Louisiana Leadership Institute, which will be open for the remainder of this month as long as tests are available. And let me reiterate that, as long as tests are available. The hours of operation for these sites vary, and that information can also be found at brla.gov/COVID. There you're going to find a list of testing sites throughout East Baton Rouge Parish. Now, all of these community sites are possible due to collaboration between our local, state, and federal government, our healthcare providers you see here in our community organizations. I want to especially thank our partners at the Louisiana Department of Health for being a consistent partner in our commitment to ensuring that our residents can seek the tests that they need. Because I've said this before, we must all work together to protect our community here in Baton Rouge. I don't know about you, but I want 2022 to be healthier than 2021 for all of us. And with that in mind, I want to ask our residents to please avoid calling 911 for COVID-19 testing and non-emergent conditions. This can overwhelm our first responders as well as our hospitals who receive patients from 911 calls. It's critical for us to ensure that we have access to these resources for our residents who are in critical condition and need urgent medical attention. So please reserve 911 for emergencies only so we can better serve the entire community. Once again, I just want to thank everyone here, our medical professionals, our healthcare community for joining me today. Thank you for the additional insight into the Omicron variant and the state of our hospitals as well as the state of our community as a whole. I know that together, and we've done this before, we can certainly move past this wave, and we can also protect the health and safety of our family, our friends, and neighbors. And I will take any questions if you have them.
As was made clear, there's a testing shortage, especially with rapid tests. I guess, A, is this from just an abundance of people trying to get tested? And B, what are we doing to bring more tests online to meet the demand? Or is there anything we can do?
Well, I'll let our medical professionals share. I have some thoughts about that too.
There's been, I think, both parts. There's been a large number, more than we've ever tested. People have decided, I have symptoms, I've been exposed, I'm asymptomatic, I better go get tested. And I understand where all that comes from with the guidelines. But now that we're so short and we're waiting on companies to deliver, vendors to deliver, the government has talked about delivering, As the mayor said earlier, we're in this together, so waiting for one or the other. I think that a lot of us, ambulatory practice, myself and Dr. Ralston particularly, I've practiced medicine for 33 years. I have talked to patients about cold and flu with or without tests. And as long as these symptoms are manageable, I'm not afraid to do that without testing. It's not going to change the guidelines for wearing a mask or isolating. If you test negative too early, they're going to tell you test again. By the time you test again, you're through your 5 days. You wear your mask for an additional 5 days if you're improving and you're back in the community. Stay away from family members. We would do this for the cold or the flu very similarly. If you're sicker, if you are short of breath, if you're not getting well and you have to come to the emergency room, there will be testing, there will be availability to determine the cause and take care of it. If we were going to make a difference, and when these oral pills come available, and we have high-risk individuals, when there's more availability for other treatments for this variant, that could all change. It could all change tomorrow. But for now, we're comfortable telling patients, stay home as long as it's mild cold symptoms, and we test if needed. You shouldn't have to test to go back to work. I know there's conflicting news there. We know for the last 2 years, we've said don't test for 90 days because the virus can live but not able to replicate, not able to be contagious or infectious. And so a lot of learning, a lot of data coming on board. And so we've been comfortable for 2 years sending folks back to work and school without testing. We're going to see variations. There's already variations out there among businesses, but that's how we're going to treat you one-on-one, I think, most physicians talking to patients.
Yeah, I really don't have too much more to say, but my comment was just going to be that the lack of tests is not just indicative to Louisiana. It's happening all over the nation, as you in the media certainly have seen.
A quick follow-up. Is LDH or the state doing anything to help ensure that maybe we get more rapid tests in the community or to make sure we have adequate testing?
Yeah, absolutely. You heard me say that LDH has been a super partner in all of this. And so whenever they have access to tests, they immediately reach out to those of us here in the East Baton Rouge Parish. So they're doing their best to help supply us with the tests. Yes. I'm sorry.
Mayor, we're postponing Martin Luther King Day celebrations. It's too soon to look into what's going to happen with Mardi Gras.
Yeah, you know, it's a fluid and changing situation. We decided, and it was not only me, but we have a whole committee because it's in January, and right now we're, you know, in the thick of things, that because it's a January date, that for the overall safety, and so we can enjoy it, maximize this holiday experience with service. We're going to have people out in the community. We have large events planned. You know, I had a gala planned that we thought we would put it off to February because we'll have a better grip on what's going on for MLK Day. Was that your question, all of it?
I said kind of a lead in. Is it too soon to start thinking about Mardi Gras?
Yeah, because as I said, it's a fluid situation, and we're just encouraging people to mitigate right now. And I believe that as I confer with our medical experts and we get through January, that we'll have a better grip on what we should do for February, including Mardi Gras.
For a health official, is there an estimation of when we'll peak for Omicron? And if so, what will that signify?
I'm going to let a health provider. The question was when could it possibly be a peak for Omicron? Is that what you're asking?
And what will that peak signify? What will that mean for us?
I think most ways of thinking right now in the science and medical world is that because it's so contagious, it's moving very fast, so we should peak sooner. Early suggestions could be as early as March, by mid-March. Get through the peak and have it wind down. What does that mean ramification-wise? We get more immunity to more people, at least in part. We still need to be vaccinated. We still need to be boosted. We wait for the next variant. Very likely to come I think there's no way to start that prediction. Let's get through this wave first. But, you know, if the virus continues and we're still in a pandemic, that we could easily see another variant, or this one could decide to last longer. But as fast as it's going, we think that it should peak sooner.
You want Doctor?
Yes.
Doctor, one.
Just y'all's thoughts on in-home testing. Do you think we're setting a lot of people out for getting negative results that might be just because they did the test wrong? You know, there's a big margin of error, I feel like.
In the midst of a pandemic like we're having now with such a high positivity rate, if you're symptomatic and you test positive, it's a positive test. If you're symptomatic, it's negative, and you test it early, there's a good chance it's positive and it's a false negative. You need to test again later, or just by the time you test again, you're going to be through your 5 days, isolate and move out. But the tests are good, they're quality, and they can be trusted, particularly with a positive test. If you're asymptomatic and you're negative, you could test positive that night, you could test positive the next day, you could be on the verge if it's an exposure. So again, testing every day, which would be difficult because you can't get enough home tests to do that. We just recommend the patient watch and be patient and watch for the symptoms, know the symptoms, and try and avoid the exposure. You certainly can't go back once you've had an exposure. If we were going to do something about that, it may shed a different light, but right now we're not doing anything with prophylactic medication for that.
So it seems like, okay, so it seems like to me that if the more prevalent message here is just either get vaccinated or wear your mask, social distance, and wash your hands, because testing is not going to be all that accurate, so people shouldn't stress that much about getting tested. It should rather either get vaccinated or do the mitigation method.
There's no doubt mitigation should be the message. Vaccinate, vaccinate, vaccinate. Wear your mask when it's appropriate and social distance, as you said. Absolutely. Testing is appropriate. We're not going to throw testing out with the dirty water. We don't want to do that. There's a point for testing. You just have to interpret testing in the sense that it is, and you have to be able to get the test. And what we're saying is that if you can't get tested, we don't want everyone to panic. We will be able to get through this with mild symptoms. You're going to stay home and you're going to do what the guidelines tell you to do anyway because you have cold symptoms and you may be, if you had influenza, we would tell you to stay home for 3 to 5 days. So it's really not any different. I think that's the message. We don't want this to be a negative connotation at all. It's simply everyone take a step back, monitor your symptoms, treat your symptoms, and use the resources that you have available and lean on your primary care doctors.
The concern with Delta was, of course, our ICUs. Has that concern shifted to our outpatient clinics and our ERs now that maybe those are being overrun given our circumstances right now?
Well, they're definitely overrun because there's a number of staff who are infected because they have outside lives just as everyone else does. I think everyone in the hospitals, our colleagues, I think we're all masking within the hospitals again. We're taking all the precautions. We still see a very low, if any, transmission from staff to patient once they're in the hospital. If you come in with a non-COVID condition, we're not seeing patients go home with COVID or have to stay longer. So that's a positive. If it spreads so fast, I think the biggest concern is once you start hitting the feeble population that have other medical problems that are chronic, and you put them in the crosshairs of the COVID virus, that you may push them one way or the other and cause some of the other complications. So we could end up seeing more ICU patients as we move through the surge, not so much because the virus itself is going to do it as much as what it may tip over. Or it will change in the midst, as we've seen them do before, and cause greater illness. But so far, we haven't seen that trend yet.
Are we experiencing a backlog of COVID cases since the holiday?
No, I think we're pretty on target. I think the biggest backlog we have is just not knowing the home testing.
Any other questions, guys? The doctors will be here for a moment.
Once again, I want to thank the media for helping us get the word out on this. You've been one of our partners in this whole process, always showing up when we want to share the information. So thank you once again, and thanks to all of our medical professionals who came out today.